Well, I think there's a couple answers to that question. I think some of the concerns you'll see is the frequency of comorbid conditions. You want to recognize what else they may be suffering from and consider the other conditional issues that they're suffering from to best pick a medicine that might be appropriate for them. Are they suffering from depression? Do they have generalized anxiety or social anxiety? Do they have an eating disorder? Do they have skin picking or hair pulling as an aspect of their OCD? Those dimensions of the diagnosis might dictate whether or not a medicine is more appropriate than other medications. But ultimately, it comes down to the appropriate class of medication being used and the dose and duration of that medication being appropriately directed. For psychiatrists and for psychiatric professionals specifically, I think the hardest task, particularly in an outpatient setting, is assuring that the therapist is doing the right work with the patient. Medication alone is most likely not going to resolve the condition. There's relief and there are conditional aspects of medication that in and of itself will be important and necessary. The therapy is the most important part. I think researching online, the International OCD Foundation has a list of therapists that they recommend or at least have shown their ability to treat the condition. But I think if a psychiatrist keeps in mind the cognitive behavioral therapy technique of exposure and response or ritual prevention, does the therapist engage in that, and is the therapist providing that support for the patient is the most important aspect of treatment that the psychiatrist can assure.